Medicare is a federal health insurance program run by the federal government. So let's start the very beginning, which was 53 years ago when they signed Medicare into law, and they made the entry age 65 to mirror the entry age at that time, which was the same for Social Security. That's the first thing that people know about Medicare, is that you get it at 65, and that's not quite true. You get Medicare when you qualify, and you qualify by working at least 40 quarters, and that's generally 10 years. Or you can get it because you qualify medically because you've become disabled anytime before the age of 65. In general, when we talk about your clients, they're going to be people that have worked at least 10 years, or their spouse was a qualifying worker, and they're 65 or older. But just remember that there is another whole population that is under 65 that is on Medicare disability. So for the purpose of the rest of these training videos, we're talking about what's commonly known as seniors. Some people don't like that term, but people that are 65 or older. So all during your working career, they take money out of your paycheck. If you're employed, the employer matches, and that money goes up to the federal government for Medicare. When you turn 65, you have the option to quit working, retire, and take Medicare, or continue working. And more people find it financially impossible to retire at 65. So when we're talking about seniors, when we're talking about people aging into Medicare, most commonly we're talking about people that retire at age 65, but not always. There'll be a larger and larger segment of your population that are over 65 that are retiring at any time past 65. Now, that's a key thing to understand, because your rights under the Medicare system vary depending on, did you come in at 65 or did you come in later? So this is a long video series. Just keep that in the back of your head and let's keep going. Medicare is a federal program. The federal government controls that. You're familiar with that because you've worked with, in many cases, security. So you understand there's a higher level of scrutiny and regulation from the federal government. When we talk about Medicare, we talk about Medicare insurance products that are meant to fill the gap in Medicare. If you don't buy any supplemental products, if you're just going to say, hey, I worked my whole life and I get Medicare for free, which is the fallacy that many people labor under. I paid in my whole life, so now I'm 65 and I want my free coverage that I'm entitled to. What would that be? So you would get Medicare Part A at 65 or earlier if you took Social Security earlier. Medicare Part B, you have to be proactive and you have to sign up for. This is a copy of the new Medicare cards that were new as of 2019. You still might find some people that are confused and are trying to use their old card. So if they do, call us, we'll help you with that problem also. The new Medicare card will have their name as they registered with Social Security or Medicare. Now you think that's a simple one, but that can be a trip right there, because this guy doesn't go by John, he goes by Leonard. And every document, his driver's license, everything he does says J. Leonard Smith. Or he doesn't even put the J, he just goes by Leonard Smith. You would say, well, it won't really matter with Medicare because clearly they're going by the identification number, which is, I don't know why, but it's not true. However they have signed up for Medicare and Social Security, that is how you, the agent, must use their name on all applications. Okay? So it's always good to ask them to see their card and see how they signed up. This catches you time and time again when your application gets turned down. The number was correct, the name was wrong. So now we go to the number. The Medicare number used to be everyone's Social Security number. That changed in 2019, and now it is a random set of 11 letters and numbers, so there's no way to predict it. That was to prevent identity theft. So they will get a generated number, and that's what they will use. They will use this card when they go to the doctor. They typically will use a insurance card when they go to the pharmacy. Hospital, A and B. So we said you get A automatically when you turn 65. You've already paid for that your whole working career. So it is paid up. It is a benefit you are entitled to as long as, like I said, you've worked at least 10 years or you have a qualifying spouse. So your A covers everything in the hospital. Everything in the hospital. So if you go into the hospital and you have heart surgery, you'll see a specialist, you'll see a therapist, you'll have nursing care, you'll have medications, you might have therapy, lung treatment, on and on and on and on. You need a walker, you need oxygen. All of that, everything that happens inside the hospital is covered under Part A. Okay? It's easy, stay with me. Part B is everything that happens outside the hospital. What happens outside the hospital? Commonly, your doctor visits. But also therapy, you need a hospital bed, you need a wheelchair, you need a walker, oxygen. All of those things, everything outside the hospital is covered by Part B. And Part B you must proactively sign up for and pay for monthly. Now these two dates of when you got each, typically they're the same for the majority of Americans because they retire at 65 and they sign up for their Part B. So it is parallel with Part A. However, you will see many times these dates do not match. 1, if they signed up for Social Security early. 2, if they were on disability. 3, if they decided to work past 65 and delay Part B. All of this you will become very well acquainted with because you will be able to help your agents traverse this crazy maze that is Medicare. So at the beginning, we just want you to understand that Medicare, original Medicare, the government program, is composed of A and B. Now you'll say, but what about C, D, E, F, G, H, I, J, K? And that is because, unfortunately, the supplemental plan that supplements Medicare, sadly enough, has letters denoting all the different plans. So people confuse the chassis that is Medicare, original Medicare A and B, with the supplemental insurance you need to fill the gaps in original Medicare, which are Medicare supplements plans A, B, D, F, blah, blah, blah. So let's go back to original Medicare. What does it cover? It covers about 80% of your costs. And when I say costs, I mean Medicare approved costs. Because the first question you get is, will it cover cosmetic surgery? Will it cover LASIK? Will it cover experimental treatments? No. Whatever Medicare deems an approved cost, your insurance will pay about 80% of it, and you will be on the hook for the other 20% of it. So a lot of people think, well, that's cool. I can cover 20%, no problem. I had a 20% copay on my employer group health program anyway. 20% is not capped. So if you had an employer group health program, it was probably capped at least 1 million or higher. There's no cap on Medicare. And so you don't want any of your friends, families, or God forbid your own clients to say, all I need is original Medicare, because that would be very dangerous. You could easily have a bill that exceeded $100,000 in 1 year, and I've seen bills much, much, much higher. So you want to fill the gaps in Medicare by getting supplemental coverage. And here we show you the two choices. You have traditional Medicare supplements, which is where most of your clients will want to land. Medicare supplements give them the flexibility to go to any doctor that accepts Medicare and any facility in the nation. Medicare supplement is a Cadillac choice. Or Medicare Advantage. Medicare Advantage is also a good choice. However, it's not quite a Cadillac. You will be limited to networks. You will only be able to go to certain doctors and certain hospitals, and there are many more restrictions. But these are the two choices you're going to help your clients traverse: Medicare Supplement or Medicare Advantage. You might have to help them with understanding the basis of what Medicare is, and that's something you'll be going over in the seminars. Medicare A, Medicare B, how to sign up for it. Now, the chassis of Medicare, we're talking about the basis, the fundamental government program, has more letters. Okay, Medicare Part C is a Medicare Advantage. There'll be another video that strictly covers Med Advantage, but for the purposes of this intro video, I want you to know that Medicare Part C is Medicare A and B, and potentially D, combined together, and we call that C. I know, right now it's getting a little frustrating. Stay with me. Medicare Part D. This is the only part that will ever be easy in your quest to dominate this new subject matter, and that is D stands for drugs. Medicare Part D, prescription drug program, is a separate program that the American consumer can buy a private drug insurance policy from a private insurance company. You cannot get it from the federal government. You do not get it on your federal Medicare ID card. It is private, it is technically optional, and it's something you will also become very well versed in. So the chassis that is original Medicare is A and B. We have C as an option, D as an option. That is Medicare. So now let's go into supplemental benefits. As I mentioned, you'll choose between either Medicare Supplement or a Medicare Advantage. Most of your clients are going to be middle income to higher income, and they will want, if not need, a Medicare Supplement plan. Now when I say want, don't we all want to drive a Cadillac? Don't we all want a Lexus? Yeah. Nobody's going around saying, I'd really like to get myself a new Kia Rabbit, or I don't know, whatever my daughter drives. You want the bigger package. You want the most insurance for your money, and that is a Medicare Supplement. That's what I would buy if I were on Medicare and I could afford it. A Medicare Supplement gives you flexibility. It allows you to see, as I mentioned, any doctor that accepts Medicare and go to any hospital in the nation. So it's very important if you have clients that do travel or have children that are out of state, that you make sure they understand if they want to go with a lower cost Medicare Advantage plan, that they understand they very well could be out of their network and essentially out of pocket for all their Medicare expenses. So a Medicare Supplement is our starting point that we're going to talk about. That's what you'll be training on. And that is much more simple because a Medicare Supplement coordinates with Original Medicare. So when you go to the doctor's office, you give them your Medicare card and your insurance card. And let's say, for example, we're talking about Mutual of Omaha. Mutual of Omaha has been doing Medicare supplements since they started Medicare 53 years ago, and they are one of the gold standards. Mutual of Omaha, AARP, there's very few that have been in the market the whole time. United American. So Mutual of Omaha will give you an insurance card. That insurance card will coordinate with Medicare so that when they send the claims in from your doctor's office, Medicare pays their 80%, the other 20% is paid by your Medicare Supplement. The client will get a statement that says this is what happens, that's your explanation of benefits, and the client doesn't have to do anything. With a Medicare Supplement Plan G, which is the most popular plan, the plan you will most likely be selling. The Plan G, the only out-of-pocket that your client will have will be for an annual deductible. Now that annual deductible will go up every year. It's based on the cost of living index, and it's announced every year around late November. If there's bad inflation, it might not go up at all, but typically it goes up a little bit every year. So what your client pays for Medicare Part B and what they pay for their deductible both typically go up a little bit every year. That's something they're not expecting. People have these preconceived notions about Medicare. One, that it's free. They worked their whole life, they lost 15% out of their paycheck, they assume it's free. Two, they assume it covers everything. So they assume, incorrectly, that it automatically covers their drugs, which is completely false. They must elect to buy a drug program, they must pay for a drug program. Medicare doesn't cover everything. It's going to cover a certain percentage of your costs, and Medicare itself has its own deductible. So if you buy a supplemental insurance plan, that will wrap around Medicare and will give you much broader coverage and reduce your risk down to essentially your monthly premium and your annual deductible. So that is the intro to Medicare. In the next video, we're going to talk more about Medicare supplement insurance plans.